Hi everyone, myself Saranya, Assistant Professor from SNS College of Allied Health Science, Coimbatore. Today I am going to discuss a very interesting topic about laryngoscope. So, laryngoscope is a medical device we are using in the surgeries, and it is a very important crucial device for giving and ventilatory support and to provide a phonation for the patients. So, what is this device looking like? It's like an hammer or it's like an hook. Okay, but the purpose of this instrument is varies with lot of efficiency to support the life. When the patient is coming with a life-threatening condition, this laryngoscope plays a vital role in supporting their life. So what is larynx first? Larynx is a pathway of our body which helps for the phonation as well as for the respiration. So we are talking, we are speaking, we are screaming, whatever the sound we are producing, it all depends upon the voice box. So this voice box plays a major role in producing a sound. And also, it is also a respiratory pathway which connects to the trachea. And you know that the larynx have different parts. You have an hyoid bone, you have an thyroid bone, and also you have an cricoid bone. So there are various types of bones present on the larynx region. And the V-shaped structure is called as voice box or a laryngeal box. It helps you for the phonation. It produces a sound. So when the patient has been admitted for a surgery, they need a respiratory support. Or if the patient is under coma, surely they need a respiratory support. To provide a respiratory support, we are using a device called as laryngoscope. Laryngoscope will provide a respiratory support and will access the pathway for intubation. So what is intubation as? Intubation is a procedure for inserting an endotracheal tube. So while inserting an endotracheal tube, as a surgeon or as an anesthesiologist, they will visualize the pathway of larynx into the trachea. So the visualization pathway will be easily done with the help of a device called laryngoscope. So this is a laryngoscope I am raising in my hand. And this blade-like structure is called as a tongue pathway, where you will be inserting a laryngoscope into the patient. And it has a very linear tip. This tip will be placed in the patient's tongue region, at the end of the tongue region, and the epiglottis will be opened. And you will have a hook-like structure which is attached to the handle. So this one is called as handle. So in this handle you will have a battery. So this battery will provide a support of light. You can see a light here. This light will be helpful for visualization of the patient's tracheal region. So how you can insert this laryngoscope? How it will be inserted is based on the position of the patient. So as an anesthesiologist, the person will be standing behind the head of a patient, and the laryngoscope will be inserted in this manner into the patient. So automatically the larynx will started opening, and this light will produce the very easy visualization of the tracheal region of the patient. So when inserting, you have to open the patient mouth. How you are opening the patient mouth is help of an heart. You can see this. So likewise, with the help of thumb finger, you will be opening the patient's mouth and you will be inserting the tube. And it is very cautious that while inserting this laryngoscope, you have to secure the tongue, you have to secure the teeth as well. You should not damage any of the pathways of the larynx. Okay, and after insertion of the laryngoscope, you can visualize the area of the larynx and you can insert an endotracheal tube in this pathway. So what is the position that patient will be lying is of sniffing position. Sniffing position is a position the patient will be lying, and you can open their head up. Like this way you can open their head. This area of joining is called as occipito, okay, Atlando-occipito joint. So you can elevate the patient head and you will be inserting the laryngoscope directly into their tracheal region. So this is the main purpose of the laryngoscope. The blade is of various sizes. It is from various sizes which you can use from neonatal into adult. So there are various blades which we present according to the mouth region. So what is the main indication for using this laryngoscope is the patient's respiratory pathway has to be secured, or if the patient is having any respiratory infections, or the patient is having any tumor on the throat region, It can be easily visualized with the help of laryngoscope, and there are various different types of laryngoscopes we are using. We are using a direct laryngoscope and we are using a video laryngoscope, which will be easily visualization can be done on the monitor so that the surgeons can visualize the screen for the placement of the endotracheal tube. And also this laryngoscope insertion can be in a good manner and it should be done with the professional persons. Why I am saying this? The laryngoscope can able to cause the damage in the tracheal region, or it can cause a wound on the tracheal region, or the teeth or the stitches can happen. So this can be avoided by proper handling of the laryngoscope. That is a very important thing about laryngoscope. So you can see here, the one question I am going to ask is, where is the battery for this light present? Yes, the battery for the light is present in the handle. The handle is a region which will take up the battery backup. Okay, so the battery backup can be with the help of laryngoscope. Okay, thank you for listening.